inglés y hacemos en medley.
Tú dilo todo en inglés, ya si hay unas preguntas, pues.
Hi, everyone. As promised, this is Dr.V on my Mexican adventure. I am about to get my first stem cell transfusion with exosomes and peptides. This will be a very unusual video because it's going to be somewhat bilingual. So if anybody has any questions, you can start popping them up. So we will be we'll be talking. So for those of you that don't quite know, my ID is hanging right here. Some of you that might not quite know. So stem cells are widely used in the United States for specific conditions. So joint issues, blood-borne cancers, and for only experimental use under research. Down here in Mexico, we can use them for other things, including rejuvenation and anti-aging. So of course, I'm always looking for some of the ways to not only help you, but help myself, right? We're all in this together. So I know that there were a lot of questions as I've been talking to you guys. And so I wanted to show you how the infusion is. So in this case, I don't have anybody to actually inject any part of my body, but they can be used in conjunction with PRP for aesthetic procedures, both on skin, plastic surgery to improve healing and avoid scarring, and can also be used for fertility, but that is that's coming up. All right. Okay, so I have some fertility questions. So I will be going through some of your questions, but at the same time, if anybody has any questions about what we're doing here today, just feel free to reach out. Para los que están viendo esto en español, estamos en México haciendo la primera transfusión, mi primera transfusión de células madres con exosomas y péptidos. So, para que vean más o menos, hay mucha más información en las redes en español que en inglés. El origen de estas células madres es de células mesenquimales a nivel de placenta. Sí se pueden sacar de su propio cuerpo, de la grasa, pero es mejor las placentales ya que son células más fuertes, más jóvenes y proveen un proceso de sanidad más grande. So going back to English, this will eventually be available for while use in the United States once it is FDA approved for this purpose. Right now, as I was saying, it's only being used for cancer-borne blood cancers and articular issues like arthritis, lesions, and under research institute. So it's not quite open yet for fertility or anti-aging purposes in the United States. Okay. So what's the difference? And so I'm going to try to, go back and forth. So please all be very patient with me. So what's the difference between PRP? And those of you that have heard me, I do a lot of PRP. I've done PRP on myself. I have about 12 years of experience with PRP in different parts of the body. So PRP is your own healing proteins. But if you think about it, it's kind of a beacon, right? It is your signals, okay? We harvest it from your blood, and it's your healing proteins and your signal to provoke your own body to heal, right? It's kind of your own stem cells. However, your stem cells are your age, right? And not only that, but they will also be affected by whatever is that's going on with you. However, if we take that to the next level, and the PRP is actually not alive, right? It is just the signal. It's the signal. That's what it is. But if you take that to the next level, then now you have stem cells not only from like day zero instead of 45, 46 years old, but also they are alive. And if you especially use them in conjunction with your healing signals, then they potentiate each other and cause even more healing. Alrighty. So And yes, I hear a question. Has Mexico seen this work for fertility? Yes, there actually are some clinics, especially in the northern portion of Mexico, that are doing stem cells for fertility and intraovarian injection. Okay. Entonces, como les estaba diciendo al grupo en inglés, el PRP básicamente son las señales que usted tiene para estimular la sanidad del cuerpo, ¿ok? Para estimular sus propias células madres a rejuvenecer el área que estamos indicando. Pero el PRP no está vivo, el primero, y dos, las células con las cuales se va a regenerar son parte del mismo cuerpo que tiene la condición en adición a la parte de edad. Entonces no va a ser tan poderoso como utilizar unas células que son básicamente día cero, porque son a base de placenta. Muchas veces me preguntan si va a haber una respuesta inmunológica y no. Eso fue una de las primeras preguntas que le hice al doctor Nario. No hay una respuesta inmunológica en contra de estas células. Sí puede haber una crisis de índole de sanidad, ¿ok? Porque para que haya sanidad tiene que haber un proceso inflamatorio, va uno con la otra, pero es transitorio y puede durar de 12 a 24 horas. Se puede sentir un poquito maluco, pero es ese proceso de sanidad, ¿ok? Bueno, voy a ver algunas de las preguntas que tienen. I'm going to be answering some of your questions. Alrighty, so Miss Ariel, I'm 6 days and 5 days post-fresh, so good luck with that, okay? You're going to need at least 10 to 12 days to really figure out if your transfer works, so many blessings to you. Can priming with Omnitrope, estrogen, and progesterone delay and stop your menstrual cycle? Yes, it can. The 3 medications can do that because Omnitrope is a hormone. You know, it's actually human growth hormone, so it's going to affect some of the other hormones. And I've seen where if they create cysts, those cysts could be hormone producing. So then, yes, it can definitely affect that. Okay. All right. What type of patient would benefit from stem cell therapy? So actually, decreased ovarian reserve patients, and that's kind of the group that brought me to Mexico, okay? As some of you know, I have a passion for helping 40 plus ladies get pregnant and the low ovarian reserve patients. So low reserve patients, definitely the ones that, let's say we got some improvement with PRP, but then we kind of hit a plateau. This would be a great therapy to add to what you're already doing. And then what else I was going to say? Yes. Then there's a few other cells. For example, the lab that we're working with down here also produces natural killer cells, and those are helpful in terms of tumors. So I'm thinking fibroids. Actually, I was speaking last week with a beautiful lady, and she has a huge challenge in terms of she has chronic hepatitis B, she has history of clotting disorders, and she has this like recurrent fibroids that won't stop coming. She's already had 5 surgeries to remove the fibroids, and then they just keep popping, and she doesn't want to have another one. So that might be a good choice for her to do natural killer cells to take care of the fibroids, and then potentially come back a week later and do some stem cells to really expedite that healing. Stem cells are used, I don't have a lot of experience with it. That's why I'm here. I'm a fervent believer that I should try it first before I ethically can recommend it to you guys. So I want to see what it does to me, how I feel, so I can then share it with you and ethically say, okay, you can do this, right? But stem cells are used very similar to the PRP, okay, in terms that you have to do a series. One treatment might be enough, but in certain scenarios, you might need multiple treatments to get to where you need to get. How much time do you think we need before some retrievals and after the PRP stem cells? I would say the same thing. I would treat it very similar to the way I treat PRP. So give it about 3 to 4 weeks for the to get the maximum effect from your therapy. Okay, like I said, probably with the stem cells, you don't need as many treatments as you do with the PRP to get the same or better, but there is a possibility that you need more than one, and the recommendation is to do it monthly. Okay. Wow. So if we have elevated NK cells and cytokines, but no fibroids, so the stem cell treatment help? Absolutely. It's going to provoke general anti-inflammation and then, cause some healing. Another application that I'm thinking of is endometriosis. Huge endometriosis not only is a condition in itself, but it also it's also associated with decreased ovarian reserve. I have a beautiful lady that is actually going to join me tomorrow, and we've been working on this for a while. And she has endometriosis. She's only well, she turned 40. She's 40 young old. And her ovarian reserve is like lingering at 0.4, but it's being low, and we've been working together for about 2-3 years now. Okay. All righty. Very good. Sí, si hay alguien en español, sé que la mayor parte del tiempo estoy hablando en inglés, pero si hay alguien en español, siéntase en la libertad de comunicarse. Si tiene alguna pregunta en particular, me puede mandar un mensaje por Messenger. Voy a intentar hacerles un video más explicativo para la población en español, pero pues como esto es en vivo durante mi transfusión, pues ahí vamos todos de la mano. So if anybody has any particular questions about anything that you're seeing today, just feel free to message me through Messenger if we don't discuss it right now. This is just me sharing with you a piece of my life. I'm here as a woman and as a 40-plus beautiful lady trying to have some rejuvenation on my own. And I just wanted to share with you because I've been discussing this with some of the consults that I've been doing that have low reserve and other issues. And I think this would benefit some of you. So sharing is caring. Are a lot of Americans traveling there for this? Yes. So actually, Dr. Nadio, his background is internal medicine. So he doesn't really have a lot of GYN experience, but he sees a lot of children with autism and other health issues. And, cancer patients, a lot of cancer patients that either decide to do this type of treatment 100% or in conjunction with their chemotherapy, because think about how chemotherapy works. It's a poison. It'll kill the good, the bad, and the ugly. But believe it or not, cancer cells are actually weaker than your good cells. And that is what chemotherapy is bargaining on, right? That you will recuperate because your good cells are actually stronger. But imagine if you can give yourself your chemo and then right away do stem cells, then it gives a better chance for your good cells to recoup and then get rid of some of the side effects. So he does a lot more of internal medicine, cardiac, I'm sorry. Oh yeah, renal insufficiency. So venga, presente, saque la cara. So I'm going to introduce you guys to Dr. Nadio. So here we go. Take a seat. Venga por aquí, señorito.
Hello, nice to meet you. I'm the Dr. Nadio. I'm sorry, I'm not speaking English very well. I can introduce for myself, but I can explain everything about the stem cells. But if you have some question, the Doctora Maribel, he can translate her. Okay.
Sí, quería presentarles. I want to introduce Dr. Nadio. So he is my new friend and partner on this adventure. He has a lot of experience with it, and he is the head of the research for the lab of the cells that we're using, which are CBC cells. And he's actively working on new applications. But like I said, his background is internal medicine. So that's kind of how that goes. So este es el Dr. Nadio, es mi nuevo amigo y compañero en esta aventura. Su background es en medicina interna, pero él es el director del departamento de investigación del laboratorio donde estamos utilizando estas células madres. Entonces, ¿quiere hablar un poquito?
Sí, básicamente lo que nosotros hacemos en el laboratorio es investigación, tanto ciencia básica como clínica. Sabemos en qué sí funciona y sabemos en qué no funciona. Y una de nuestras publicaciones lo hicimos ahora recientemente con el tema de la pandemia, lo hicimos en COVID. en células troncales mesenquimales. Hicimos una publicación internacionalmente en donde el protocolo fue significativo y a raíz de ese protocolo también estamos atendiendo pacientes con long-COVID.
So what he was saying is that his most recent publication was actually on COVID patients and treating in conjunction with the therapy that they were receiving. And there were the very, very sick ICU patients that were about to, cross over. And the effect of adding the stem cell therapy to whatever they were doing was significant. The patients that were treated with stem cells in conjunction with traditional treatment in the ICU survived, while, the other ones actually did not. But I wanted to kind of introduce him, and, you'll be seeing a lot more of him as we move along. All righty? Gracias.
You're welcome.
Are they younger cells, not your own, or similar to PRP process? They're actually younger cells. You can get your own stem cells either from bone marrow or fat. However, after discussing with Dr. Nario the risk benefit ratio, those cells are good. They're fantastic. Okay, they are the stuff that heals you. However, they are your age, and sometimes they have also been exposed to whatever disease process you're dealing with. Okay, so for example, let's think about premature ovarian failure. That is in general an autoimmune disorder. So those cells are being exposed to that type of environment as well. So not only they're a lot older, they're exposed to that. So then we go back to the placental cells, okay? That is the next best thing to embryologic cells. So embryologic cells in general are not really used for multiple reasons, but then placental cells are also derived from the pregnancy. So they are day 0, and they do not exhibit, okay, the molecules on the skin of the cell that will cause a host graft reaction. Okay, so it's not going to react against your body, but they're alive, so they're going to go and actually heal your tissue in a way that's far more powerful than your own stem cells will do. And that's the reason that I was convinced, for the with the information given, that I am doing it myself on my body. So the nurse is going to come and get my blood pretty soon. All right. My husband is actually going through it right now, but he does not want to be part of this adventure. He doesn't like needles. So anyway, so if anybody has any more questions, just feel free. Okay. Will this procedure be available in the Atlanta office? Not yet. Like I was saying before, unfortunately, the applications of stem cells for other things other than cancer-based, blood-based cancers and articular, so joint disorders, and research, only research, that is what the FDA has approved this for. So unless we create a research lab in Atlanta, the answer is unfortunately not at the moment. However, I like to think outside the box. For those of you that have worked with me for years, you know that I do that all the time. So we will be facilitating the process for you guys getting these treatments down here in Mexico. So this is my scouting trip and my first trip down here. I'm getting familiar with how the system works, to be able to share it with you guys, for those of you that might be interested, either for any health issues or for fertility, even for sexuality. There's some interesting stuff out there, but for those of you that have worked with me, I can see the applications on many areas in conjunction with your PRP. And like I was explaining before, your PRP is the beacon. Your PRP are your own emergency signals that you need to restructure and heal. Okay, that's how it works. But if you can add living cells to your beacon, then it potentiates each other. Another thing that we're getting transfused today, all right, are something called exosomes. So what are exosomes? There are little vesicles. They're microscopic, vesicles that are derived from the stem cells, and they can get to the tissues a lot faster, and they cross the blood-brain barrier, so they can be used on different things. And I was reading last week, that even for depression that is resistant to depression, anxiety that is resistant to treatment, or in conjunction with the treatment that you're on. So, and then we're going to be also doing peptides and IV vitamins, because now we're getting the cells. How about we give the cells the raw material to work, and then the exosomes will be guiding also those stem cells to get to the different places. So a lot of you might be questioning, so you're getting an IV transfusion, but I really want my liver to get better. How about my ovaries? Oh, I have a back injury that I would like to fix. Because these are live, it's not like the PRP that you have to put it somewhere. These are live cells. They're intelligent cells. They will be following the emergency signals that your body's putting out. Okay, so that's where the magic of the PRP might come in terms of, kind of guiding them places. But so the ones that will go in, they're going to go everywhere where there's injury or issues in my body. And the research is showing that 25 to 30% actually stay in our lungs. That's kind of sad. It's all the toxins and junk that we're breathing. And then the rest gets distributed through the body. Okay. All right. Okay. So, para explicar brevemente en español, lo que estaba explicando es que no solamente se hace la transfusión de células madre, sino que también se hace la transfusión de exosomas y péptidos y de vitaminas intravenosas. ¿Por qué? Los exosomas son vesículas derivadas de la célula madre, que son como unas señales, tienen un poquito de mRNA, pero pueden llegar más rápido a donde se necesitan y cruzar la barrera cerebro-sangre, ¿está bien? Entonces, inclusive se han implicado en mejorar depresión y ansiedad que no responde bien a medicamentos tradicionales, ya sea en conjunto a o como sustituto. Entonces, volviendo a eso, entonces si uno le pone los exosomas, eso ayuda a las células madres, ¿ok? Las células madres, ¿por qué se ponen intravenosamente? Son células vivas, inteligentes. Ellas van a ir a perseguir la señal de emergencia que hay a través de su cuerpo, al punto de que, por ejemplo, sabemos que el 25 al 30% se va a mantener en los pulmones, ya que respiramos un montón de porquerías y los pulmones de todo el mundo están un poquito, afectados. Entonces, pero el resto se va a distribuir. Ahí es donde está la magia de poner PRP de pronto, como para indicarles dónde las queremos. ¿Está bien? All right. Very good. And again, Spanish, English, if anybody has any question, español, inglés, si alguien tiene alguna pregunta, siéntanse en la libertad de comunicarse de manera privada o a través de este medio. ¿Ok? Muy bien. Algunas de las otras aplicaciones, como estaba mencionando, problemas cardíacos es otra. Como decía el doctor, la usa en autismo, en cerebral palsy, en las rodillas, exacto, en coyuntura. Igual, básicamente es parecido a las aplicaciones del PRP, pero aún mucho mejor, volviendo al tema de que son células que están vivas. ¿Ok? Bueno. Listo, Choco, listo. Hola, Angélica, ¿cómo estás? Esto sí, esto te ayudaría con la endometriosis y hay varias técnicas para eso que tengo en mente basado en cómo funcionan tanto las natural killer cells como las stem cells. Y para los ovarios, sería muy bueno para las personas con endometriosis porque lidiaríamos con los dos problemas de una. So I have one of my beautiful patients, Angelica. She's been with me, oh my God, like 12 years now. And she was a tough case of endometriosis. And yes, they will help endometriosis. Because again, they're live cells, especially the natural kill cells, I think, because natural killers, some of the theories of how endometriosis works is that you actually have defective natural killer cells. And that's why sometimes I support the immune system so it indirectly works better. Okay, so if you're actually giving a transfusion of, of natural killer cells, then it's gonna they're responsible for cleaning. They're responsible for cleaning the implant. So it would be a great thing to do natural killer cells, just like the fibroids, followed by stem cells. Okay. Angélica, desgraciadamente lo puedes probar, pero te tienes que venir conmigo en un viajecito para México. No son legales en los Estados Unidos para esta utilidad. Solamente se pueden utilizar en los Estados Unidos para problemas de coyunturas y cánceres de sangre. Ok, ya casi es mi turno. Así que, okay. All right. So, like I was saying before, if any of you is interested, just let me know. I understand this might pose a lot of questions. But like I said, this is my scouting trip. I will be organizing, facilitating this process. I am partnering up here with Dr. Nario in Mexico to make this available for those of you that are on whatever journey that you're in. Okay. El viaje, Angélica, solamente si de verdad te interesa, escríbeme un mensajito por Messenger y te doy los detalles. Probablemente esté viniendo mensual. Y entonces ya según siga procesándose esto, va a ser un poquito más fácil, pues la transportación. El área es muy segura, o sea, sé que eso es un issue que ha salido, o sea, una preocupación. No he tenido ninguna preocupación. Los taxis, todo se mueve súper bien. Alquilar un carro en el aeropuerto muy bien. Me estoy quedando en el Candlewood Suite sin problema. El hospital está precioso, así que relax. So I was sharing with Angelica that, I know that safety and security is a question that a lot of people have. I haven't found any issues. It's an international airport, no problems. Taxis, Uber, everything works well. It's fairly easy to rent a car. There is a lot of American companies. Yesterday I went out with my husband to grab some food, and there was like Chili's and Outback and Hooters and Applebee's. I'm like, oh no, I didn't come all the way to Mexico to go to Applebee's, but it is there, familiar stuff. I'm staying at the Candlewood Suite, so it's a well-known brand. So I think this is going to be a very good thing, not only for myself, for you guys as well. Okay. And so Lisa, I am so sorry you couldn't join me on this trip. I know that there was a lot of back and forth. But yes, I know that was a big concern for you and for some of the ladies that actually joined me. The travel was like, it was a direct flight from Atlanta, no issues. So there's some people that are going to join me, some close friends and family members. And they're traveling via Cancun because it's a lot cheaper. I decided to do direct flight for logistics. So to give you an example, my sister and her husband, they spend the weekend in Cancun, went to the beach, and then they're coming and they're getting their transfusion tomorrow. Lista. Okay, my turn.
¿En qué brazo?
Aquí. So. ¿Sí? Ah, no, mija. Si no encuentras la vena, te colgaste.
Ajá. Están justamente en el carrito, en la parte de abajo.
Sí.
Voy a poner el torniquete, es una
Claro.
fuerte.
Tranquila. Haga lo que tenga que hacer.
Así.
Súper.
Voy a limpiar, ¿eh?
Lista, chocolista. Ya les voy a enseñar. Claro que es un IV. It's just an IV, right? So, pero I'll let you go how I feel. I'll give you an update, guys, tomorrow. Mm-hmm. Let the healing begin. Amen. Amen, Sara. You never know, I get this IV transfusion and suddenly I'll end up pregnant with you guys. My mom would kill me.
Perfecto. Voy a fijar, esto a lo mejor molesta un poquito.
Tranquila.
Y voy a sujetar bien, ¿ok?
Mhm. So IV going. And you see the liquid up there. It's because he has the peptides in it, so that's why it has that color. And vitamin B complex and vitamin C, it's in there as well. So I'm getting a bomb, people.
¿Puedes traducir si quieres que este es el vial de 100 millones?
Mm-hmm. Bueno, métale mano.
¿Yo?
Bueno, so the doctor is gonna show you how the stem cells come in. Mira. All right, so this is it. CBC cells. I'm gonna get 100 million cells. This is important, people, because there's people out there. You know how human beings are. There's people out there that will give you stem cells and you get 2 million. That's not how it goes. It has to be 1 million per kilogram of weight as the bare minimum. I'm getting 100 millions because I'm gonna be Superwoman next week.
Okay. Tal vez no se aprecian desde aquí, pero el vial no es transparente, es turbio, y la turbidez se debe a que las células se pueden observar al ojo. Entonces el vial es turbio y se pueden observar unos grumitos flotando, pero esas son las células y eso es importante que el paciente las pueda ver al ojo humano.
So he's saying that you can actually see, okay, it looks transparent, okay, but you can actually see the cells floating. It's very important because that's going to determine that the cells are there, okay?
Lo que vamos a hacer es abrir el vial.
Ahí está la turundita arriba.
La turunda. Ok. Ok. Limpiamos la turunda, el tapón del vial y posteriormente extraemos 8 mililitros de estas células y mi enfermera va a proceder a aplicarlas en el puerto en Y donde se pasan los medicamentos.
So they're actually, I'm just going to show them, they're actually injecting it in the medicine port, right? Straight into my vein. It'll be somewhat diluted, but it's going to go straight in. So Angelica is asking how many days this stays in your bloodstream, in your system, and that's actually a great question. So this mode, 7 days. They will be in your system for 7 days if they are applied IV. They stay in your system 2 weeks if they're applied through the bone. Okay, that's another way. But the magic happens when it can be done intraperitoneal. ¿Cuántos días es que se quedan intraperitoneal?
Pueden durar hasta 21 días.
21 days if it's intraperitoneal, all right? That means inside your belly. Girls, ovarian reserve magic.
¿Molestes?
No, I'm feeling great. I don't feel anything. It's just an IV infusion. So the infusion lasts for about an hour, okay? So it goes pretty slow. And then what else? And then, yes, the healing crisis, because my body's going to start reacting, right? Healing. If you have like an old injury, it's going to flare up as it's healing because you're calling attention to it, right? The stem cells in the body, it has to eat up the scar tissue and rebuild it. So that's going to be a little uncomfortable. And that lasts 12 to 24 hours. Okay. So is that what you're going to do? So for those of you that are coming with me, we'll probably do intraovarian PRP. So that will be with anesthesia. All right. It'll be just about the same. And then the stem cells. So I will be putting stem cells intraperitoneal under anesthesia with the ovarian PRP and then the IV infusion all at the same time for a big, big bang. Se puede hacer dependiendo la condición, pero mensual. Mensual yo creo que es un buen...
Sí.
Mensual es un buen, a menos que esté lidiando con una enfermedad un poco más complicada. Es decir,
Si es una enfermedad autoinmune que es refractaria al tratamiento convencional, lo ideal es que se quede por lo menos unos 3-4 días aquí en México para hacer un tratamiento más prolongado.
Yeah, if you're dealing with like an autoimmune type of disorder, then you might want to stay in Mexico 3 to 4 days for a more intense treatment so they can actually do several. So as the cells are going, if any of you have had NAD IV infusions, that's how it feels. I'm feeling a little oozy, like I'm getting a little margarita in my vein. So if any of you have had an anti-aging IV infusion, it feels like that, like a little weird feeling. So when I get the the anti-aging boost in my office, that's how it feels. Not bad. I can handle it. A little bit of a headache, a little bit of, weirdness. Is this beneficial for transfers too? Absolutely. I'm thinking of, for example, people that are handling low, thin lining, refractory to normal treatment, that no matter what, the lining doesn't get up. I'm thinking of Asherman people. I have a few ladies that are battling scar tissue inside the uterus. I bet this is going to be a home run for these girls. Okay, so you said you might need more than one treatment. I think you have to evaluate. I mean, because this is pretty powerful, people. So I would try to do one treatment. Es que estaba enseñando.
Cuando era mucho tiempo pensé que te habías
So I would do one treatment and then give it that full month to see what benefit we can get, because it might be all you need. It would, my hypothesis is that you will need a lot less of this in comparison with the PRP, because again, the PRP is your signal to stimulate your cells to heal. So sometimes you have to kind of do more than one. Okay. Very good. All right. All right. Well, this IV infusion is going to go for about another hour or so, because they do go slowly for anybody that's sensitive. And I will give you guys an update on it. And as usual, sending you tons of love, and sharing is caring. Así que ya les daré un update. Aquí voy a estar un rato más. Cualquier pregunta, cualquier cosa, pues se pueden comunicar conmigo a través de el Messenger. Bye bye.
¿Molestias?